this video, we are going to be examining how a volume osmolality diagram would be altered in 5 medical cases. You are treating patient 1 in the ER with the chief complaint being a severe headache. This is a hot, humid day in July, and the patient has been working outside mowing his lawn. Assuming dehydration, the patient is infused with normal saline. However, it is later determined that the patient is suffering from a migraine headache and is not dehydrated. The information is provided for us that this IV solution is approximately isotonic at 286 milliosmoles per liter. The name normal saline is derived from the fact that the saline solution has an osmolality relatively normal to a patient's blood. Since we have added excess fluid to the patient's blood, the extracellular fluid volume would increase. However, since this fluid is relatively isotonic to the blood, there is no change in the extracellular osmolality. In order to visualize this process, I picture an analogy with a red drink. Let's imagine that the pitcher of fluid is our patient's existing blood, and the glass of fluid is our IV solution of normal saline. You'll notice that the color saturation of the two fluids is the same, indicating that they are the same osmolality. If we add the IV solution into the pitcher, representing the patient's blood, you'll notice that the volume increases, but the concentration, indicated by the color, does not change. So if we revisit our scenario, the extracellular volume has increased, but the osmolality has remained the same. Thus, the cells of the body are in an isotonic solution. Consequently, there will be no net flux of water and the intracellular compartment will remain unchanged. So we should see a volume osmolality diagram that looks like this. The extracellular volume has increased, but there are no other changes in the patient's volume or osmolality status. Patient 2 has ingested a very large volume of bottled water during a radio contest. Bottled water would be considered a very hypotonic solution, as it contains very few solutes. Since the patient has been ingesting this large volume of fluid, the extracellular volume would be increased. Since the bottled water is hypotonic, the osmolality of the extracellular fluid would be drastically reduced. The cells of the body are thus in a hypotonic solution, in which the concentration of the extracellular fluid is less than the concentration inside the cells. Consequently, water will move via osmosis from the extracellular fluid compartment towards the higher concentration of solutes inside the cells. Thus, the intracellular volume will be increased, and the intracellular osmolality will be decreased. If we draw this on our volume osmolality diagram, it should appear like this. The volumes of both compartments have increased, and the osmolalities of both compartments have been decreased. It's worth noting that this was an actual case in which the patient tragically passed away from the large ingestion of water. Our third medical patient presents to us with mild diarrhea following a recent spring break trip to Mexico. Commonly referred to as traveler's diarrhea, this is a condition that occurs in many individuals traveling to Mexico due to the ingestion of bacterial pathogens. Our first step is to determine how this situation would affect the extracellular fluid volume. In this case, our patient has lost a volume of fluids from the GI tract, which is a component of the extracellular fluid, so our extracellular fluid volume would decrease. Now it gets a little bit trickier when we imagine what would happen to the extracellular osmolality. As the patient experienced diarrhea, it wasn't just fluid leaving the body. There were also a number of solutes such as sodium chloride and glucose. In fact, the fluid lost from the body is approximately isotonic with mild diarrhea, so there will not be a large-scale change in the extracellular osmolality. In order to visualize this process, I imagine a pitcher of red drink, with the saturation of the color indicating the concentration or osmolality of the drink. I can then pour out a glass of drink from this pitcher to simulate the fluid loss that occurred during the diarrhea. You'll notice that the concentration of the fluid lost is identical to that of the original fluid. Furthermore, notice that the fluid left behind in the pitcher has remained the same color, indicating that we were still in an isotonic state. So if we return to our volume osmolality case, we can see that with mild diarrhea, the cells of the body are in an isotonic solution. So they will not experience a change in intracellular volume or osmolality. If we place this information into our diagram, it would appear something like this. Notice that the extracellular volume has decreased, but there is no change in extracellular osmolality. Thus, there was no change in the volume or osmolality state of the intracellular compartment. Patient 4 is a man who is currently homeless and experiencing severe dehydration with syncope during a hot summer day. During dehydration, the patient would lose a large volume of fluids from the extracellular space, and the solutes left behind would become more concentrated. While he would most likely also be sweating and thus losing some sodium and chloride, the loss of fluids would still be expected to be greater than the loss of solutes. So the extracellular osmolality would be increased. The cells of the body would now be in a hypertonic solution. Thus, water would exit the cells by osmosis. This would decrease the intracellular volume while increasing the intracellular compartment osmolality. Thus, the patient's volume osmolality diagram should appear like this. Both the intra and extracellular volumes would be decreased, and the osmolalities would be increased. Patient 5 has been self-medicating with regular ingestion of concentrated sea salts, believing that this will minimize her arthritic symptoms. In this case, the patient has added highly concentrated solutes, sodium and chloride, into the GI tract. If we examine the extracellular fluid volume, the patient has ingested the saline solution, so the extracellular volume would be increased. Additionally, this fluid was very concentrated, so the extracellular osmolality would also be increased. The cells of the body have now been placed in a hypertonic solution. As you'll recall from our basic diagram, this hypertonic saline solution would cause the cells to shrink, moving fluid via osmosis from the intracellular compartment to the extracellular compartment. So in this case, our intracellular volume would go down, and the extracellular volume would experience an even larger increase than we originally reasoned. The intracellular osmolality would also increase due to the loss of water from the intracellular compartment. Thus, we would see a volume osmolality diagram that looks like this. You'll notice that the osmolality of both compartments is increased due to the addition of the solutes, and the water has moved by osmosis from the intracellular compartment to the extracellular compartment. Thank you for helping to solve these 5 medical cases using a volume osmolality diagram.